Santi speaking to us this afternoon on that media encounter with the president yesterday. That's dominated our bulletin for the half hour that we've been here, but we'll continue to bring you some other stories right now.
Let's turn attention to the health sector now, because the Government and Hospital Pharmacists Association has made an urgent appeal to the President, the Ministry of Finance and the Ministry of Health to expedite financial clearance for 599 newly qualified and inducted pharmacists who have remained unemployed for nearly 10 months since their induction. GOSPA warns that the continued delay in posting these young professionals is putting a significant strain on an already overstretched health system, while also threatening the professional futures of affected pharmacists. The association further reviews the stark staffing crisis in hospitals across the country. We can now have a quick chat on the back of that. We can speak to Pharmacy D, Dr. Emmanuel Mensah Bonsu. Doc, good afternoon and thank you so much for joining us here. Let's start off with the staffing crisis that we could be faced with as a country. Elaborate on that.
Okay, so thank you very much. So this is Dr. Emmanuel Sowiafe. I'm the National Chairman for the Government and Hospital Pharmacists Association.
My apologies.
Okay, so the key point we are raising here is that yes, indeed, these 599 pharmacists have been, duly inducted to practice. And the point is this. After the induction, these pharmacists are posted to complete their housemanship, which is a compulsory part of their post-induction kind of training and then, experiential build-up. And so it is a compulsory process. And what happens is that until you complete this housemanship, no employer can appropriately even engage you. We have instances where pharmaceutical, companies, industries, and some private community pharmacies even want to engage these pharmacists, but because of the pending housemanship, they cannot go ahead with it. And that is the very unfortunate development we are talking about. 10 months the line, pharmacists are waiting to just complete their housemanship. And because of the lack of clearance, they are just made to wait. And this is a very, very unfortunate development.
I see, Doc, but paint us the picture, right? If we are unable to post pharmacists across the country, what is the impact on the ability for pharmacists to be present at our health facilities?
As it is now, there is a very, low pharmacist to patient ratio. If we look at the World Health Organization standard of, 1 pharmacist to 2,000 patients, Ghana is doing, 20%, barely 20% of this. And so the ratio in Ghana is very wide. We have very few pharmacists attending to the various needs of patients across the country, and this is a very precarious situation. We actually cited an instance with the Fiakwanta Regional Hospital, which actually requires some 35 pharmacists, but on roll as we speak, only 11 are posted. And that is the situation across the various healthcare institutions in the country. And this is affecting patient care. Few pharmacists are available on the wards to attend to the various clinical, pharmacy services, medication therapy management services across the country, and it is affecting the provision of healthcare services, and it is not to the benefit of our cherished patients.
And Doc, you're saying that the last major recruitment of Pharmacists was some 5 years ago. What's been the engagement with the ministry, the sector ministry, which is health, and other stakeholder ministries like finance? What have they been telling you?
Okay, unfortunately, it's just, I would still say it's just been, verbal promises, because obviously, as we are all very much aware, the sector minister graciously indicated that they are prioritizing, the recruitment of even pharmacists permanently. But as it stands now, it has still not, it has still not been done. For us at the labor front, we keep engaging the Ministry of Health, we keep engaging the Ministry of Finance, but we kindly are drawing the attention of His Excellency so that, these things should be speeded up. Practically, we are talking about a halt in the career progression of some group of, professionals who cannot move on to the next step simply because they have not been posted to do their housemanship.
I see. You may have heard the health minister tell us that they have to create the room to be able to find that money and then employ health workers. What meaning does that make to you as pharmacists?
We believe that, investment in healthcare professionals is investment in the wealth and the health of the populace. And so, yes, despite the fact that there may be, competing interests, that for recruitment of these professionals should be given the utmost priority.
I see, Doc. We'll see how this plays out. Thank you so much for talking to us. We've just been talking to the National Chair of the Government and Hospital Pharmacists Association of Ghana, Dr. Emmanuel Owusu Riafe. He's a pharmacy D. You're still here on News Central. We'll take a quick break. When we come back, we'll bring you more stories, including it has lost an estimated $28 million as of Tuesday. We'll tell you why and how when we return.
And you're back here on News Central. Let's take you out of the capital Accra into other regions right now, because Asanko Gold Mine says it has lost an estimated $28 million on Tuesday after an irate group from Mpatuem clashed with the military at their mining site in Isase. Dispute over a concession has escalated between some local miners and the company, resulting in the death of 2 persons, including a local assembly member. William Evans Inkum has been following the developments, joining us right now via Zoom. But on your screens right now, we're showing you footages of what appears to be very expensive mining equipment, and all of that set ablaze, amongst many other things. We're seeing security presence and what have you, all on standby. And yes, very serious mining equipment haven't been burned, but let's try and connect right now with William Evans Inkum, because they say $28 million is the estimated losses they've made from that clash alone on Tuesday. Evans, that figure is quite steep. Have they stated how they are going to seek to recover in terms of these losses, and what's the situation in the area right now?
Well, so there's relative calm. It's something that they also want the public to know in terms of losses as far as the current impasse is concerned. But beyond what Asanko is showing us, the military, I mean, they have also been talking. I mean, yesterday they issued a statement, one establishing why they are in the operational areas of Asanko mines. Of course, they stated that the Ashanti Regional Coordinating Council is aware, the Amansia South and West District Security Councils, they are aware, and of course, they are also saying that illegal miners are also aware that they have been providing security for concessions belonging to Asanko mines. Of course, they've also said that what triggered the Tuesday's clashes, which of course have to do with the death of one Kwesi Bonsu, who happens to be an illegal miner, according to the statement issued by the Ghana Armed Forces. Kwesi Bonsu was among some illegal miners who had invaded one of the concessions, which was under the protection of the Ghana Armed Forces. And when they were chased out, according to the statement, the illegal miners told the military men that while they were in the process of avoiding the military wrath, Kwesi Bonsu fell into a pit. So the next day, which was September 9th, some irate youths in or from Mpatuem took the corpse and deposited it at the Isase base of the military. And according to the military statement, there was a confrontation. Look, Mawena, the military statement did not mention or did not state that there was a gunshot.
Right.
That statement was very news as far as that statement is concerned. Only to say that there was a confrontation resulting in injuries on the assembly member for Abuabo, Samuel Dankwa, and of course, he succumbed to that injury. So these are some of the things that the military have been saying as far as the current impasse at Mpatuem is concerned.
And Evans, going forward, what is the relationship between the mining company and the people going to be like? Because you've been trying to explain the genesis of what may have caused this. We're seeing security presence there, but has there been the kickstart of a conversation going forward to ensure that reprisals do not come about, or the persons going back to wanting to mine again, resulting in clashes like this in the future?
Well, currently, you will not describe it as harmony. The Ashanti Regional Minister, who also happens to be the chairman of the Regional Security Council, was supposed to be there today, but that meeting has been rescheduled to tomorrow. And we understand that his presence is to ensure some level of harmony between the locals and, of course, Asanko mining.
Right then, Evans. And so that meeting is expected for tomorrow, but we know that
absolutely.
Security presence continues to remain in the township and the mining area.
Well, absolutely. So the military, they are still providing essential services, as they've been stating, which of course is in line with the state-mandated security intervention coordinated through the Ghana Chamber of Mines. And the reason why they are there. So they are still providing security.
Evans, thank you. I'm sure we'll follow up tomorrow as well when the Ashanti Regional Minister does visit the mine so we can get details. My colleague William Evansinko.
I will say across the regions, because Member of Parliament for Esikado Ketang and Deputy Minister for Health, Dr. Grace Ayensu Dankwa, is calling for the revision of the Western Regional Response Plan to combat the Mpox outbreak there. With 224 confirmed cases reported in the region as of September 9, 2025, Dr. Ayensu Dankwa emphasized the need for new concept notes and modification to bolster the region's preparedness and response capabilities.
Informative session as the various district directors brainstormed on the way forward. Presentation after presentation, it came out about how they are trying to deal with the high prevalence rate of Mpox here in the Western region. When it comes to the Western region, the highest is 71 in the Takwa Insoye municipality. This is followed by Sekendi Takwade, which has 69 cases, and then Amenfi East with 37 cases. And then we have bits and pieces scattered around. For instance, when you go to the community municipality, they have 12 cases. But what came out was that they are actually doing the necessary education and all that, but there are gaps. And this is the issue that was raised by the Director for Public Health, Dr. Asiedu Bequin, who did not understand why all of this was happening, yet the number of cases keep on spiking in the region.
We need to drill down. We need to get something which is missing. You see, if you look at all the thematic areas, surveillance, case management, risk communication, it's all being covered, and yet the cases are there. So why?
Sampling of people's idea or information they have about the Mpox disease here in the Sekendi Takrade reveals that many do not even know much about the disease. What have you heard about Mpox?
Yes, it's a deadly disease just roaming about, but I haven't heard anything detailed about it.
Have you heard about Mpox?
No.
You haven't heard about Mpox?
No. Nothing about it. No.
Some of the reasons which were given was that, one, it was difficult to access, especially the non-galamseyers. And these cases, we understand, are very predominant in the illegal mining communities where sex promiscuity is on the rise. Now, they told us that it was difficult to get access to non-galamseyers because some galamseyers were married and were reluctant to disclose the whereabouts of their girlfriends, who also turned out spreading the disease. So these are some of the challenges. Another challenge was the lack of or insufficient logistics. And then one other thing that stood out was the fact that the education was not being widely done as should be. So going forward, these were some of the things that the Deputy Health Minister, Dr. Grace Ayensu Dankwa, proffered.
We have identified what the problem is. So we're going to not reverse, but slightly move the course a little bit and see how best we can get to these cases, though, especially those that are lost to follow up, so that we can contact trace them and also contact trace their contacts, so that we can curb this Mpox. We know there's a vaccine component of Mpox. We have written the ministry, my Honorable Minister Akando has written to WHO. They said they have accepted, they have passed. So now all we are waiting is for us to see the vaccine with our naked eyes. So when we go back, we'll work on it. And the vaccine will be perfect because we'll be giving it at the targeted areas. It's not going to be a public thing where we give it to everybody. But we have identified the pockets. Once we identify the pockets, we'll go into the pockets and vaccinate the people.
They are hopeful that after re-strategizing, they can be able to deal thoroughly with the Mpox prevalence in the region and will be able to nip it in the bud. Erama Smith, TV3 News, Sekendi.
It's still News Central here on TV3. Now, hundreds of local poultry farmers have received live birds aimed at boosting domestic production and curbing imports. The Kwadaso Municipal Assembly in the Ashanti region has rolled out the government's Nkukon-Kitinkiti initiative in a pilot program. The initiative is a key part of a national strategy to reduce Ghana's reliance on imported poultry, strengthen food security, and improve the livelihoods and economic conditions of local farmers. Let's connect now with Ashanti region correspondent Ibrahim Abubakar. Ibrahim, talk to us about this program and its impact on farmers there.
Well, Kemini, we do know that the government Nkukon-Kitinkiti initiative will officially be rolled out somewhere in October. But because that promise has been made, some poultry farmers within Kwadaso municipality have constantly been in touch with the assembly just so they know whether the program has been rolled out, because they want to be part. Because of the pressure, the assembly had to take that initiative and do the pilot study. So for now, they have been able to identify about 500 poultry farmers within the municipality. Some have go out of business because of that activity, and they are trying to see whether this initiative will bring them back to business. And for that matter, for the first pilot, they have been able to give 50 farmers about 500 beds so that they will start with the pilot to see how it will go. I mean, an event, the official initiative or the rolling out be done, then they will know who to tackle and who to invest into. So the farmers are also excited, especially when we have just 2 months or 3 months for Christmas. They believe that this has come timely and they will be able to raise these bets and be able to serve the people within Kwadaso municipality and even part of Ashanti in this Christmas festive. Let's listen to what some of the beneficiaries have been telling me.
I don't know if you actually quite thank you if you say on the boy in democracy anyway. In Chakukona ban, a bit more boy. Sunset, you have a crabba or my moi. Let's a winner's over bois. Let's say so better. We are to win me Yawea. A big kind that's how we can become a name. In Tiabanadia, I said, I'm my president in this year. You be here to ye, near to Tengukoni. There's. It take like from now where they are, it will take like 2 months for them to be matured and edible. Therefore, instead of them going out buying imported chicken, we decided to raise our own so that this time we won't be buying imported chicken, but we will use what we have in the house so that it will be beneficial to the people and the people in the country.
Ibrahim, we just heard from the MC as well. We'll leave our conversation here for now. Thank you so much for the report. And Ibrahim Abubakar is Ashanti region correspondent.
Now, it was a moment of pure excitement and celebration as Societe Generale turned dreams into reality at the grand finale of its deposit drive promo. One lucky customer won the ultimate prize of a brand new Toyota RAV4, while 2 other winners were awarded an all-expense paid trip to Singapore and Dubai.
It was a day of thrills and surprises as Societe Generale crowned 3 lucky winners at the grand draw of its Deposits and Drive promotion. The grand prize, a sleek Toyota RAV4, went to one ecstatic customer, while 2 others secured luxury trips to Singapore and Dubai, each to be accompanied by a partner. The managing director of Societe Generale, Hakim Wazini, applauded the winners and thanked all customers for their continued loyalty and trust in the bank.
We say to our clients that you can't trust Societe Generale Ghana. Bring your money, save your money. At the end, we are recognizing the loyalty of our customers. The most important here is that we are sending a very positive message for our clients and prospects to say that when you are depositor at SG Ghana, you are likely to be very well rewarded. And we have seen that the first major prize is this very beautiful car.
The National Lottery Authority confirmed that the draw was conducted with utmost integrity and transparency.
The National Lottery Authority is the regulator of all consumer promos in the country. So as part of running the traditional lotto, we also regulate and supervise all consumer promos in the country. Our platform has our own system that we take the data through, and then we run them through our system to make sure all the participants are legitimate.
The event is part of the bank's annual tradition of celebrating loyalty and deepening customer trust.
That's it from us this afternoon.
It is
somebody's a RAV4 winner, by the way. As a result of that show.
Are you jealous?
Well, I wouldn't say I'm jealous. I'm happy for them.
You should have been a part of the whole process. You know, the process towards the winning.
I'm happy for them. I mean.
And you don't have accounts there, do you have?
Well, I mean, I'm really happy for them. Just want to, wish them all the well, but all the best. But that's our bulletin from us here this afternoon. I am Awinai.
And I am Kemini Amano. We'll see you same time tomorrow here on News Central. Bye-bye.